Professor Fox, I want to start with what the benefits of early diagnosis means to an Alzheimer's patient.
What it really means is it's as much for the family as well as for the patient. It means that people get the right treatments, but it also means that we can give people support and advice about what the future holds, advise them what they should or should not do. And it also ends what people have called an agony of not knowing. When we know that there's something wrong, or somebody's not behaving right, or they don't seem right, and wondering why it is. So that is crucially important.
Okay, and talk to me a little bit about diagnosis, because we often hear that it's impossible. I mean, you can diagnose Alzheimer's, but you really can't tell if you have it until you have a specific scan. Is that true?
So that it's absolutely right that brain imaging has taken us forward, so we have greater certainty. The ultimate test has always been examining the brain after death. So we always had based on a clinical assessment, we had a certain level of certainty. So what we're doing with these tests are we're improving our clinical certainty. So that in the past, to be sure clinically, we had to wait till people were more affected, and we would follow people, and we would look at the problem with memory has now got worse. It's involving other parts of our cognitive function, and now means that people have problem with calculation or spelling or planning. Now with these tests, we are confident enough that we can say memory problem and a positive scan. We think we have enough certainty to say yes, this is early Alzheimer's disease, and that's an advance.
Tell me a little bit about the scanning technique that you have spent so much time researching and what it means to diagnosis.
So we know that Alzheimer's disease attacks particularly vulnerable parts of the brain early on. And now with some of the brain imaging techniques that we have got, just with MRI, which is a non-invasive scan of the brain, we can look at those areas which are very related to memory and see if they're shrinking. So that will say, right, this is not just depression or somebody over anxious about their memory.